See, now there are a lot of women who are asking about the egg freezing. It looks like it's an easy way option and an easy way out, and you can buy 10 years or 12 years, but it's not like that. Because I'll tell you why. See, if you're freezing your egg, it's like you're undergoing IVF, okay? And the chances of you becoming pregnant by IVF is still, with the latest technology, is 60 to 70%. So the risk of not having a baby that still exists, that's a big amount, that's 30%, right? There are 30% chances that your eggs which you're freezing are not going to be viable after the time when you actually want the pregnancy. So it's a good option. Suppose for those, especially if you have any medical disorder and if you're undergoing any treatment for the cancer, or if you feel that your AMH levels are too low and you have such a condition where you can't get pregnant right now, you're in a very grave situation, but your AMH levels are decreasing and you're going towards premature ovarian insufficiency. In those scenarios, definitely it's a beautiful option because you're increasing your chances of pregnancy after 3 or 4 years when you're ready for it. But if you're very, very healthy, if your hormones are under control, and if all the parameters are within normal limits, then going through this process and then thinking that we are buying time, then actually you're decreasing the chances of pregnancy, and it is such a costly affair. Suppose when we are collecting the eggs for freezing, first of all, the collection process, you have to take so much, loads and loads of hormones. And you have to go through a complete IVF cycle where they do the ovum pickup and then they freeze it. And when they do the ovum pickup, suppose if we are taking 10 eggs and if we are trying to freeze them, we don't know how the egg's going to react when we are going to freeze them, right? What will be the viability of them? And when we are freezing them for a long period of time, and when we are thawing them, when we want to actually retrieve them for the pregnancy, then also that's the situation that we don't know that how much are going to respond and how much are going to come back, and are going to get viable after getting thawed. So exactly the pregnancy rate that decreases from 60 to 70%, also it decreases to 50%. So I would suggest that instead of, going through such a, I would say, a costly procedure, when everything is fine and when you can just follow up with your hormones and when you can be in contact with your gynac, and if everything is in your favor, why do you want to go for it? Like you can, conceive even at 35 if everything is fine, even at 38 if everything is fine. But if you have some associated endometriosis or ovarian insufficiency or cancer issues or some family history of any cancer, then definitely it's a beautiful option.
Husband has a lower sperm count. Is that fine?
No, it's not fine at all. See, 40%, the reasons for infertility, it is 60% female and 40% male. If it's a low sperm count, they can't become pregnant. And if husband is 35 and female is already 32, then I would suggest that they should get themselves evaluated properly, that why the sperm count is low, and if the sperm count, what is the intensity of it to be low. And if it is very, very low, then they should go for IVF straight away and not wait for any other thing. Because after 32, even her egg quality is going to go down. And if the sperm count is low at 35, that is going to go down. So we can't wait. And without wasting any time in the drugs and in all those things, I think they should go for IVF straight away.
Yes. Also within
there's one more thing I would like to tell is that if the woman is more than 35 years of age, and if the woman is getting married during that time, or they have started thinking of becoming pregnant after 35 years of age, then they should only wait for 6 months for them to become naturally pregnant. If they are below 35, they can wait for 18 months to become pregnant on their own. But after 35, the time span is really less. It's only 6 months. You should only wait for 6 months, and after that, you should straight away go for IVF.
Yeah, absolutely. And also there is a cutoff for this, that above 40 you don't wait at all. Is that right?
Yeah, absolutely. If you're getting married at 40, or if your first pregnancy you started planning at 40, there's no wait.
you
Even if
directly.
everything is fine, yeah, they should just go for it.
Yeah. We just spoke about the male or the male partner or the husband having a low sperm motility. Could you also just touch base a little bit on ICSI? Because that's not what we like as part of IVF. ICSI is also something that we do. Could you tell us a little bit about that?
Yeah, so what happens is in ICSI, what we are doing is it is intracytoplasmic sperm injection. So what we are doing is we are putting the sperm directly into the egg, okay, by the needle. So what is done, why do we do it is when the motility of the sperm is very low, or when the sperm count is very, very low, or in cases where there are absent sperm count, and then we take a testicular biopsy to take out the sperm, and in that case the sperm count is very less, we have it like in 100, or we have it like in tens number. So in those scenarios, we put the sperm directly into the ovum, so that we are not even wasting a single sperm and the single ovum, because the chances are very, very meager in such cases. So it's a very good technology, and that's the technology. If the sperm count is low, sperm motility is bad, and even if the egg is not getting matured properly inside the women, then what they do is IVM with ICSI, that is in vitro maturation of the follicle. That is, we take out the women's follicle, the egg, at a very premature age. We take it out, we develop it outside, and then we put directly the sperm directly into the ovary, because here we don't have the time, or we don't have that option of wasting a single egg and a single sperm. So it's a very good thing and a very good technology.
Yeah. So for who asked the question, I hope all this information helps you counsel your couple or whoever it is that you're helping out. We can take more questions. So if anyone has more questions, please keep them coming. And we've also in the chat mentioned our next session, which is prenatal care for you and your baby, and talking about yoga. So if that's something that you're interested in, please do sign up. And we have also got our sign-ups for the newsletter and for WhatsApp updates in the chat. Please check it out. And in the meantime, feel free to bring up your questions. I actually was going to go back and ask you on how do you think, I don't think we spoke about this, but do you have any general advice for male partners when they're trying to conceive above 30? What are some
Okay,
things?
for them, again, healthy lifestyle, eating proper. It's not only for the females, for their hormones to, keep it under control. It's not only for them also. Sleep, exercise, diet. Important thing is smoking, alcohol. If they think that even they should get their tests done on regular basis, like how a female is going to a gynecologist and getting their tests done, even they should go to any lab, to any good lab, and get their sperm count tested. Because it's not only about a count, it's about the motility, it's about the morphology of the sperm, and the smoking, alcohol, all these things, they not only decrease the motility and the sperm count, but they also have problems later in ejaculation, or they have problems with erectile dysfunction. All those things, they happen with smoking and alcohol. So they are very, very important. If they are planning for pregnancy, they should also stop smoking and alcohol at least 6 months prior. And there is something called as, myoinositol, which is a very good micronutrient, and that helps in improving the motility of the sperm, and also helps in improving the quality of the egg. So both the males and the females, both the partners should start taking it, and even the males should take folic acid, because even the sperm is made up of genetic material, right? So even the sperm quality has to be good. So folic acid helps in improving the motility of the sperm, and also so both of them should start taking their prenatals before 6 months. It's very, very important. They should exercise regularly, and together, they can do miracles. So if they do it together and both the partners are contributing together, so it's always a good pregnancy.